www.healthcmi.com. Acupuncture Continuing Education Online. Today, acupuncture cancer pain relief confirmed. If you go to healthcmi.com and click on news, look for the article with that title, published January 25, 2020. Acupuncture alleviates cancer pain and reduces opioid use. Research conducted at the Memorial Sloan Kettering Cancer Center in New York, RMIT University Australia, and Guangdong University, the researchers conclude that acupuncture reduces pain levels for patients with cancer and that it reduces the need for opioids as a result. So this was a result of a meta-analysis of 14 randomized controlled clinical trials. And this was published in the Journal of American Medical Association Oncology. They started with 17 RCT, so randomized controlled trials, with a total of 1,111 patients. And they boiled that down to the quality trials. So that was 14 RCTs with 920 patients. 7 studies were from China, 6 from the USA, 1 each in Korea, France, Brazil, and Australia. And the investigators took a good look at this and note that pain is a common reason for cancer patients to seek emergency medical services, and that hospital admission is also common for cancer patients visiting emergency departments. They add that hospitals need to include acupuncture services to address this demand based on, quote, growing evidence of the efficacy of acupuncture. They also note that researchers from Memorial Sloan Kettering Cancer Center in New York, also the Harvard T.H. Chan School of Public Health in Boston, Massachusetts, and the China Academy of Chinese Medical Sciences in Beijing, note that most national cancer centers in the United States already provide acupuncture. However, the investigators know that there are significant barriers to access. They cite acupuncture's exclusion from many insurance plans in the USA as a major obstacle for patients seeking acupuncture as an alternative or supplementary analgesic therapy. One issue is that insurance coverage varies greatly and is largely governed on a state-by-state basis. Acupuncture services are included on the federal level within the Medicare and Medicaid system in the U.S. However, this only applies to patients suffering from chronic back pain unrelated to surgery, and the total number of annual visits are limited. Some patients get care through the Veterans Health Administration, and battlefield acupuncture is also a service provided by the U.S. military. Again, these are more restricted, limited numbers for these programs. Notably, the American Pain Association and the American College of Physicians both recommend acupuncture as a non-pharmacologic treatment option. Acupuncture, when it is included in healthcare systems, leads to the alleviation of suffering from severe pain and nausea. That's what this research was showing. Chemotherapy patients benefit significantly from acupuncture's often immediate and lasting ability to relieve nausea and vomiting. The scope of cancer research examining traditional Chinese medicine is diverse. For example, University of Texas MD Anderson Cancer Center in Houston and the Fudan University Cancer Center in Shanghai researchers note that acupuncture reduces the frequency and severity of dry mouth for head and neck cancer patients receiving radiation therapy. So research indicates many cancer centers already provide non-pharmacologic analgesic options to meet the needs of their patients. Acupuncture's role is expanding in this environment to alleviate suffering and provide treatment options. All the conclusions and statements here about acupuncture are substantiated very carefully in the article if you take a look at it at healthcmi.com with clear references. So go to healthcmi.com, click on news, and look for the article entitled Acupuncture Cancer Pain Relief confirmed. And you'll find all of those references in this article. A very, very serious topic. At the Healthcare Medicine Institute, the Pang family has decided to release a treasure trove of formulas they've been using for generations to help patients with things like cancer. So that is going to provide a lot of relief from suffering, help people to sleep better, support their immune systems, help them to endure chemotherapy and radiation in a more humane and livable fashion. So that is in the works, and that has been taking some time. It's a very deep study and involves advanced herbal medicine. So something to look forward to at the Healthcare Medicine Institute in terms of our acupuncture continuing education courses. So that is up and coming. And again, Professor Jeffrey Pang is the Dean of Five Branches University Academics. So very, very important information will come out on that topic to really help establish and guide people with protocols necessary to assist patients in their time of need. I'm Adam White, licensed acupuncturist. Thank you for listening. www.healthcmi.com